All right. Tonight's session is a continuation of last month's part 1 diabetics. Last month, we cover basically the risk factor, and basically the focus on last month's session was on the prevention part of the type 2 diabetics management. All right. Today, we're going to cover the second half of the diabetic management, which is actually more involved in the management of diabetic complications itself. Right? So let's start with some baseline because there are some of the data and chart I show will refer to some what they call glucose marker as a reference, so that just for everybody to recall, the way we measure our blood sugar and the way we determine whether we are suffering from diabetic or not is actually based on 3 clinical markers, basically on the measurements of the blood glucose criteria. Okay, so the first one obviously is fasting plasma glucose. This is the most common one and probably the most used because it also used at home. All right. The second marker actually is more used in clinical context because you measure the average blood glucose level for the last 2 to 3 months. So this is what we call HbA1c, or glycolated hemoglobin itself. Right. Then we have the third marker, which is less commonly used. It's the oral glucose tolerance test itself. All right. So anyway, this is just a recap of our last session. The marker we use for diagnosis of diabetic itself. Okay, just an overall view of what we have done, right? So these are the table. This table shows the stages in the diabetic management, type 2 diabetic management. Part 1, which was last month's what I call session, the content. Basically, we cover the risk assessment, the risk factor management, and we focus on the prevention of diabetic insulin resistance. Try to prevent pre-diabetic to progress into diabetic itself, right? So today we cover the continuation of it itself is when patient or typically reach a stage whereby that we are critically diagnosed as a diabetic. Then what are the complications? What are the basically comorbidities that diabetic patients often have? And what are the complications they will face? And we will focus on how to manage the progression of the diabetic conditions, as well as how to prevent and manage the complication of diabetic patient. Okay, now let's look at the stages in the diabetic management. So if you hear, it's just a repeat of what I've just said just now. You can see from here that the part 1 itself cover basically the stage whereby that before one were diagnosed with diabetic itself, right? So the markers that we are focusing on, or what I call the clinical endpoint of focusing on, will be on weight management, lipid disorder, and hypertension. So for the prevention of diabetic itself, just a recap, right? Basically, 2 of the key most important factors to manage is actually the management of weight management, as well as basically doing exercise. These 2 are the most effective means of diabetic prevention itself, right? So when the diabetic is progressed into the clinic, where we consider that the patient has already reached a stage whereby that is clinically diagnosed as a diabetic itself, then the focus is going to be on actually the microvascular diseases, which is caused by the diabetic conditions. And in this case, we will be focusing on all the common known cardiovascular diseases in the context of prevention of complication, right? Then as the diabetic progress, right, then the complication arises from the microvascular diseases will emerge, and basically we will be looking at microvascular diseases like retinopathy, which is actually the eye diseases, nephropathy, which is the kidney diseases, and a neuropathy, which is the nerve diseases itself, right? So let's look at the prevalence of diabetic-related complication. This is actually an overall view of the types of complication that diabetic patient will have and how prevalent are they itself. You will see from here that actually microvascular complications are more prevalent than the macrovascular complications. Microvascular complications are complications related to fine blood vessel, the small blood vessel itself. And what are the complications? We will be talking about chronic kidney diseases. We'll be talking about neuropathy, which is the nerve diseases, nerve damage, which actually resulted in diabetic foot problems. And we'll be talking about the diabetic eye diseases itself problem, right? So this will be the microvascular complication of the diabetic patient. Then the large blood vessel diseases complications are mostly fall into the cardiovascular diseases category, like heart attack, chest pain, coronary heart diseases, congestive heart failure, and stroke. We will be also touching on these cardiovascular diseases shortly. Okay, now let's look at the large blood vessels complication, right? So the prevalence of actually macrovascular diseases, in fact, you can see from here, put it that way, 32% of the diabetic patient will suffer some form of cardiovascular diseases. This chart basically shows that. Then among them, one of the highest prevalent rates are actually coronary artery diseases, which is diseases relating to heart blood vessel itself. Right. So this accounts for actually one of the highest prevalent rate in the CVD spectrum itself. Right. Followed by actually atherosclerosis and heart failure and angina pectoris. This is basically chest pain, a symptom of chest pain itself. All right. Then you have a heart attack, and then followed by the stroke itself. So if you look at it itself, right, the heart diseases, coronary artery diseases itself is actually one of the most prevalent form of macrovascular disease complication of a diabetic patient. All right, now let's look at some of the diseases in these cardiovascular diseases and how the relationship, the risk factor is affected by actually what they call our blood glucose level. We use the marker as HbA1c, which is the actually glycerated blood glucose as a reference. You can see from here, the heart attack, AMI, which is heart attack, ischemic heart disease, which is your heart diseases itself, the peripheral artery diseases, as well as stroke itself. You can see that as your HbA1c marker goes up, that means your blood glucose level goes up itself, right? Your relatively hazard ratio, which is actually the risk, actually increases itself. Basically, the increases are due to your increase in glucose level in the blood. It's actually across the full spectrum of cardiovascular diseases itself, right? So you can see from that. But one thing that I want everybody to notice, if you look at it itself, there is also a U-shaped relationship between all these bed of diseases. And what it means is that actually having optimal glucose level is important. That is the point where you have the minimum cardiovascular risk, right? But if you are having not enough of glucose in the blood, you also would carry the same increased risk of cardiovascular diseases, as seen from this chart itself. So therefore, it's important that we are not talking about control. We are not talking about reducing our blood glucose to a very low level. But what we are talking about is controlling the optimum range of blood glucose level in our blood. Is the optimum range. So not too high and not too low. Okay, now let's look at another context itself. How is the cardiovascular diseases affects actually the type 2 diabetic itself? The causes of death in diabetics itself, actually the majority of the death is due to cardiovascular disease incident. You can see from this chart itself. So there's two statistics here. One is actually Singapore statistics itself. In Singapore, 46% of death, diabetic death is by CVD. Right, you can see from there. And then this is another report which is actually more of talking about the Western countries itself, but very similar in context itself. About 50% of the diabetic patient death is actually caused by CVD itself. Among them, 30% is caused by the heart disease, 29% caused by heart failure, and then 11% caused by stroke, cerebral vascular diseases itself. So you can see from here that the major cause of death for diabetic patient actually is fall into cardiovascular diseases. Okay, now we talk about why the cardiovascular diseases is so prevalent and the cause of death is so much attributed to cardiovascular diseases in diabetic patients. The reason actually is that there is a relationship between diabetic patient and lipid disorder, right? So let's look at this condition, right? Lipid disorder is very common in type 2 diabetic patients. It's affecting around 60% of diabetic patients. Now this chart shows that if you are a normal person, normally the prevalence rate is about 40%. But else, if it's in type 2 diabetic, the prevalence rate is close to 60%. That means that if you are in type 2 diabetic patient, there are 60% chances that you will suffer from lipid disorder itself, right? And then another study, basically you can see from here, right? You show that if your diabetic condition is uncontrolled, that means that you are not able to control, then chances are that you almost certain, is more than 90% chances are that you will suffer from some form of lipid disorder condition itself. Right, you can see from here, this chart itself is about 93.4% of the uncontrolled diabetic have this lipidemia. So it's important to realize that lipid disorder goes hand in hand, very often goes hand in hand with diabetic patient itself, right? So therefore, when we want to deal with the complication of cardiovascular diseases that arises from diabetic patient, right? Actually, one of the key factors of management actually is managing diabetic dyslipidemia, which is managing the diabetic patient's lipid disorder condition itself. Okay, so let's look at the characteristic of diabetic lipid disorder. Basically, the lipid disorder can fall into three sub-class itself. Lipid disorder if you have a low good cholesterol, the HDL. HDL is actually the good cholesterol, all right? So you need to have high good cholesterol. But if you are low, then you also consider suffering from lipid disorder. And you are also suffering from lipid disorder if you are having high bad cholesterol, which is the LDL, we all know. Then another class of the lipid disorder basically is on the triglyceride level. So we also, if you suffer from high triglyceride level, you are also considered as suffering from lipid disorder. Now, if you look at the diabetic patient's lipid disorder characteristic itself, actually diabetic patients suffer one of the most complicated form of lipid disorder. Actually, all three beds of the classification class of the lipid disorder, the diabetic patient also suffer from complete three bed of it itself. You can see from here, the diabetic patient basically suffer from low good cholesterol. They suffer from high bad cholesterol. They also suffer from high triglyceride. So this is actually the full spectrum of disorder, and it's very typical of diabetic patients' condition. So now, why this is a very concern and serious condition? Let's look at it itself. You can see from here that when we look at the risk factor associated with heart attack, when we talk about heart attack itself, right? Why diabetic patients suffer from very high risk of heart attack? Why is because one of the reasons is here. You can see from here that this study showed that abnormal lipids account for 45% cause of heart attack, compared with all the other risk factors like obesity, hypertension, a diabetic patient itself, diabetic which is high glucose level, right? So therefore, you look at it itself, actually it is the lipid disorder carries the highest risk factor for heart attack, right? But unfortunately, the characteristic, the form of diabetic patients' lipid disorder itself is actually they have all three bed of the lipid subcategory suffer from all three bed of disorder itself. Now, another chart to show you why diabetic patients, right, have a very high risk of heart attack compared with people who are normally lipid disorder with one or two bed subbed or itself. You can see from here itself, right? The heart disease free probability, you will drop, right? According to the degree of the types of lipid disorder you have. For diabetic patient itself, typically you have all three. That means you have low good cholesterol, high triglyceride, and high LDL. You can see that the coronary heart disease free probability actually dropped the most, which means that actually the patient, diabetic patient, which having this lipid disorder condition generally will have the highest risk factor in suffering from coronary heart disease itself, compared with other types of lipid disorder, whereby, for instance, you can see that if a patient having a normal HDL, which means that is a good cholesterol is normal and triglyceride is normal, only the bad cholesterol is low, is high, then actually the probability of having suffering from heart disease actually are much lower compared with the diabetic patients itself. So therefore, it is an important consideration to prevent complication of diabetic patients. We focus on the diabetic lipid dyslipidemia management. Okay, now let's talk about first, what are the nutraceutical therapeutic compound that we can use for people who suffer from risk of having heart attack, right? Now, one of the symptoms of heart attack actually is chest pain. Chest pain, we call it in clinical term, we call it angina pectoris symptoms, okay? So this is a technical term for a chest pain itself. Now, this chest pain is related to the having a high risk of heart attack itself, all right? So if you look at it itself, actually, I will want to just put in context of what are the best nutraceutical currently, apart from drugs itself, right? The TCM context, in fact, there is a compound called pentax-noto-ginseng. This is not the ginseng, it's a pentax-noto-ginseng. So in Chinese, it's actually the sanqi, tianqi or sanqi. This is actually another types of ginseng, but it's not the normal types of what we call pentax ginseng we are talking about. So this herbs itself is actually a TCM herbs that actually have shown very good clinical efficacy and potency in alleviating of chest pain, especially for people who have a high risk of heart attack itself, right? I will do with all the clinical study results and details here. Basically, just to let you know that actually, if you're suffering from the risk of having heart attack and having chest pain, actually one of the best TCM herbs in here to be used actually is the pentax-noto-ginseng. Okay, now I think that we should be more interested in nutraceutical, that means supplements that actually can help prevent heart attack, right? So in here, basically, I listed 4 clinically validated effective supplement itself. How effective they are, the dosage itself is there, right? And then they are basically having clinical evidence to show that they are able to prevent or reduce the risk of having heart attack itself. So among them is actually omega-3 fatty acid. I think everybody is very familiar with this product itself. The effective dosage is 1 to 3 grams of the EPA and DHA per day, right? Another one is coenzyme Q10, right? The effective dosage is 100 to 300 mg per day, right? Then magnesium, followed by magnesium. Also, the effective dosage is 300 to 400 mg per day. Then followed by garlic. Garlic is more of a spice, but there are also supplements that is actually selling in the form of garlic extract. So if you are buying garlic extract, right, the effective dosage for you to take actually is normally 600 to 1,200 milligrams. All right. So these are the beneficial compound for people who have a high risk of heart attack. You can take this compound as a supplemental provision for you to reduce the risk of having heart attack, right? And if you are having a heart attack and then after the heart attack incidents, for the recovery itself, right? Then planted ginseng is actually one of very good herbs for actually a heart attack, post-heart attack recovery. So I will also leave it to you for the details on the results of some of the clinical study results in here. But basically, if you are suffering from a post-heart attack and you want a recovery, or your heart have a problem, then after, for instance, if you're having some heart surgery and then after that you are recovery, right? Then ginseng is a very good herbal supplement for the patient to take. Okay, now another complication actually is the increased risk of heart failure. This is also the large blood vessel complication of diabetic patient itself. Now you can see from here, there's 2 charts here. One chart is actually that the risk factor of the incident of heart failure. We actually, this chart shows all the associated risk factor related to heart failure itself. Other than the previous arterial fibrillation, which is actually irregular heartbeat, other than the medical condition whereby that you suffer from irregular heartbeat or you have previously having a heart attack, right? These 2 are the medical condition itself. The risk factor, the common, what we call the lifestyle risk factor itself, diabetic actually pose the highest risk for heart failure. So diabetic patients actually have one of the highest risk factor for having heart failure. Another chart here, you can see from here that based on your HbA1c itself, right? You can see that this line itself, as the HbA1c go, your risk of actually heart failure actually go up much more significantly higher than the other 2 factors, which is actually the blood pressure as well as high cholesterol. So if you look at it, among the high blood pressure, high cholesterol, and high what we call the glucose blood level, the high glucose blood level have the highest risk sensitivity and risk contribute the highest risk factor for heart failure. So therefore, for diabetic patient, one of the key complication, management of complication, actually management of heart failure, prevention of the heart getting weaker and heart having a heart failure. So what are the nutraceutical compound that is actually also clinically validated to be beneficial for heart failure patient? In here, I list 4, right? Among them, the top one actually is the hawthorn extract. Hawthorn extract actually is already recognized in German Commission E, which is actually the European FDA equivalent. And they basically approve hawthorn extract as a supplement for patients suffering from heart failure grade stage 2. So which means that it's really a proven in use supplement that is been endorsed by the European FDA itself, right? Another 2 compound are actually the very famous TCM herbs. One is asparagus. The other one is, of course, the banded ginseng, our ginseng. And the fourth compound is also coenzyme Q10, which is very familiar to all of us itself. So these four form a very good selections of actually nutraceutical adjuvant for people who are suffering from heart failure, right? Okay, let's look at as the diabetic patient progress further down, getting worse itself, then the complication of the small blood vessel become more evident itself. And what are the small blood vessel complication of diabetic patient? You can see from here, this chart itself, as your HbA1c progress itself, right? Retinopathy, which is the eye disease of the eye itself, actually the risk go up very much more higher, followed by the kidney disease of the kidney, right? Chronic kidney disease, then followed by the disease of the nerve vessel, the nerve itself, right? So therefore, you can see from here that these three are the common microvascular complication itself. And the prevalent rates of this in the diabetic patients is that the eye disease account for 25% prevalent rate, whereas the kidney disease patient actually are higher, 30 to 40%, and the nerve damage caused by diabetic conditions itself, in fact, is the highest prevalence itself. You can see that close to half of the diabetic patient itself will suffer from a nerve damage condition. Okay, let's start with the first microvascular complication, which is actually the eye disease itself, right? So basically, diabetic patient will have two eye diseases complication. One is retinopathy, right? This is due to the blood vessel in the retina damaged by high blood sugar, blocking the blood flow to the retina and lead to the bleeding into the retina. So actually, this condition will lead to the damage the ability of the retina to see light, which affects your vision itself. Another condition is due to the fluid build up from the leakage of the damaged blood vessel, right, in the macular area, which is behind the eye itself. So causing the eye to swell and distort the vision. You can see from here that actually the retinopathy actually are more prevalent as the diabetic progresses over the years, right? The prevalence rate actually go up very significantly over the years itself. You can see that by the time year 5 itself, more than 30% of the patient will be suffering from eye problem itself, right? So therefore, in the context of diabetic management itself, first, very important for diabetic patient, we support the need for early eye screening in them because of this reason, right? Therefore, diabetic patient must go for early eye screening for diabetic retinopathy because it is one of the most prevalent microvascular condition that can happen to them, right? So the earlier you screen and you act on it, the less chances that you will suffer from vision loss itself, right? Now, what are the natural options for diabetic retinopathy? Of course, I think that a lot of us will be aware what type of supplement is good for the eye. So carotenoid, which is actually a class of actually compound, which include a compound is astaxanthin or lutein itself. So I think both these products, this compound are available in a supplement form in a Tomy range of product itself. So these two are actually very much suitable for people who suffer from retinopathy as a viable beneficial supplement. Okay, now let's look at the microvascular complication of the kidney. That means diabetic kidney disease itself, right? Now, if you look at the context itself, actually diabetic is the major cause of the chronic kidney disease. This chart shows that actually type 2 diabetic account for the 42% of the cause of CKD itself. Then hypertension actually is the second risk factor, major cause, But if you look at it, diabetic is the major cause of chronic kidney diseases, and that is a very important consideration because of that itself. Very often you'll find that there is a high prevalence of diabetic patient having chronic kidney diseases and vice versa, which means that if you are suffering from chronic kidney diseases, chances are that you will also be suffering from some form of diabetic condition itself, right? So very important. CKD or diabetic kidney diseases itself, right, is the major risk factor. Diabetic is the major risk factor itself. Okay, now you look at it itself, the risk factor you can see from here, right? We measure the kidney function by microalbumin, what they call the hazard ratio. That means that this is actually one of the markers for kidney function disorder, right? So as your HbA1c progress itself, right, the hazard ratio for microalbumin suffering from the microalbumin condition actually go up very much more quickly. You can see that the hazard ratio go up very much higher and as your HbA1c progress getting higher. Okay, now how prevalent is actually the diabetic kidney diseases, right? Now these are some of the statistics just for your reference, right? In North America, the estimated DKD prevalence is about 35 to 40%. Mainly due to obesity and hypertension rates. The high obesity and hypertension. In China, actually clocked the highest DKD prevalence rate in the world. If you look at it, among all the region, China have up to 50% prevalence rate. That means that 50% of the diabetic patient will suffer from diabetic kidney diseases itself. It's a very high prevalence rate. This is due to the rapid urbanization and genetic predisposition of the Chinese population itself, right? So India followed very closely behind. But you look at the Southeast Asia, actually Southeast Asia is not far away from China, and that's why the Singapore have focused a lot on diabetic management also over the years, because this is becoming a very big public health problem, all right? And this is also basically Malaysia and Singapore are high prevalence rate are basically influenced by the high rates of obesity and hypertension problem. All right. So now Japan and South Korea are faring better, primarily because they have earlier screening and they have better glycemic control, means the healthcare system are much more efficient in terms of diabetic management itself. Now, what are the natural options for diabetic kidney diseases itself? If you are suffering from it, what are the compounds that you actually can help you to actually protect your kidney, right? So there's two compounds. Again, these two are actually famous TCM herbs itself. Asparagus nemerus, in Chinese called huangqi, right? And the pendant ginseng, which is the ginseng that we know, right? Among the two itself, basically, both are actually clinically proven in use in TCM context itself. So therefore, you can actually have asparagus or pendant ginseng as a tea to drink for people who are suffering from diabetic kidney diseases itself. Okay, now the third microvascular complications is the damage of your nerve or the nerve itself, right? Because diabetic neuropathy itself. Now, the nerve damage itself can affect all parts of our body, because all the nerve is all parts of body. But most commonly, it starts with your what you call your legs and your hand. So basically, we call it peripheral neuropathy. This is actually the early stage of actually nerve damage, diabetic nerve damage. Very often it starts with your hands and your legs, and legs are the most common one, right? You actually, the nerve damage will cause pain, numbness in the legs and hands itself. Then as the nerve damage progresses itself, right, it actually affects, it will progressively go up, and it can even affect our what they call autonomous nervous system, which is actually a system, nervous system that control digestion, sexual function, urination, etc., etc. We will discuss shortly itself. So if you look at it itself, neuropathy increase with time. So if you are suffering from diabetic that you are suffering from high glucose, blood glucose itself, you will damage your blood vessel, nerve vessel in the body, and then the progression actually is that as you progress itself, you can see that the proportion with the nerve damage itself actually after the 10 years of diabetic itself, you hit 40%, and when you hit 15 years, in fact, more than half of the patient will be suffering from some form of a diabetic neuropathy condition itself. So therefore, it is actually a very important consideration to start early in terms of prevention. Now, I will want to share with you, this is actually one of the most complication of diabetic complication. Why? Because you see, as the nerve affected your legs and hand, that's not that bad. You will have diabetic legs and all that, you still can manage. But when the nerve damage is affecting your autonomous system, that means nerve system that control your body's organs that are actually self-management of your body's function itself, then the self-management function get disrupted. You have a whole spectrum of problems coming out from that. And this is actually one of the most complicated part of actually diabetic patients suffering from. Now, what are the example of actually the nerve dysfunction of your autonomous system itself? First is that you can cause your heart to beat very much faster. This can easily lead to heart attack. So we call it resting tachycardia, which is actually a rapid heart rate of above 100 beats per minute itself. You can also suffer from dizziness or fainting when standing due to too low blood pressure. Now, this is actually a system your body actually can respond to. When you stand up, the blood pressure will go up to support your blood flow to your brain. Right? But when your nerve damage is damaging the autonomous system itself, then when you stand up, suddenly you will faint because there's no control of your body to actually pump the blood to your compensating effort of body to pump the blood to your brain itself, right? So you will suffer from exercise intolerance, right? You will have a slow stomach emptying, nausea, bloating, vomiting, and that feeling very much easier fill up. That means that you are not hungry very easily. All right. Now you're also having at night, having diarrhea at night, having constipation at night. This can happen at night. So more important, actually, more common one are actually people who are having bladder dysfunction. Now urinary retention, incontinence, and so on and so forth. Also, actually, it affects your sexual function itself, right? You also actually cause excessive sweating. And this is your body's loss of control of the autonomous nerve system. And actually, because of that itself, you also can control, your sweating is not controlled, not regulated, and therefore you also can cause dry skin and heat intolerance. These are full spectrum of complicated problem that is due to the nerve damage itself, right? So therefore, it is very important to actually protect your nerve from being damaged by the high blood glucose level, right? Now, what are the natural options for diabetic neuropathy itself? Among a large selection of a product, in fact, I shortlisted one compound that is actually clinically proven that can be used as an effective adjuvant treatment option in patients with diabetic neuropathy. This compound is acetyl L-carnitine. It is also available in the market as a supplement, and is commonly used as a supplement for people who suffer from neuropathy itself, diabetic neuropathy. Okay, right. So let's take a step back and look at what are the current treatment diabetic management in terms of current treatment practice itself. You look at this chart itself, it's a very simplified flow of it itself. right? Well, after the diagnosis, and you got diagnosed with actually diabetic conditions itself, right? Depending on the stage of diabetic itself, right? So if you are pre-diabetic or you are actually having just only insulin resistant itself, basically, I think the first line treatment solution strategy is actually for therapeutic lifestyle changes. Basically, exercise and eat healthily, which we have discussed in the earlier session, last month's session itself. As your condition progress and then you are diagnosed with diabetic condition, and at the early stage itself, then very often the drug will be actually oral drug of monotherapy, like having metformin is the first line of choice for the medication itself. You will probably be asked to take anti-diabetic medication like metformin, right? And control, let's monitor your control your diabetic and see whether your diabetic condition is actually controlled or contained. All right. Now, as the condition progress and getting worse itself, then the monotherapy will not be effective enough. Then as you go to the progressive stage of diabetic and the later stage of diabetic itself, combination therapy is very often part of the treatment protocol. And what is combination therapy? Basically, it's actually the medication, oral hypoglycemic agent, right, and injectable medication plus insulin therapy. Your body will actually need to be actually inject with insulin itself. This is at the later stage of diabetic condition. Okay, now what is the late stage diabetic management? So I think in terms of treatment for late stage diabetic itself, I have mentioned, right? The doctor will basically prescribe a combination therapy, right? Oral drugs with insulin, right? Then you are required to monitor the blood sugar often, right? And your food, dietary intake, you have to become very careful, right? So you need to count your carbohydrate, fats, and protein intake carefully. That means basically you need to have a restricted diet intake. That means your diet have to be regulated and controlled. Then, of course, one of the key things is that you still need to go do your exercise regularly and keeping your healthy weight itself. Now, in here, one of the additional things that for patient you need to do actually is learn to manage and prevention of complication that we have discussed earlier, right? So let's start with one very basic requirement for late-stage diabetic patient management. The very important practice is actually to have regular blood sugar monitoring, because it is in this stage, when you're at late stage, whereby that you are required insulin injection, means that your body will have to measure your amount of blood sugar in there very carefully, and you need the insulin injection to actually normalize your blood sugar level. So therefore, it is important to keep a very regular, vigorous schedule in blood sugar monitoring for late-stage diabetic patient, right? The American Diabetic Association recommend the testing of blood sugar level before meals, before what you eat, before bed, and before exercise or driving. So these are actually very important recommendation, right? If you can measure your blood sugar level at least about 4 times a day. Okay, now one of the acute diabetic complication in here, when you are suffering from diabetic and you are actually at the late stage diabetic patient and you're on insulin, it's very important for you to prevent suffering from acute diabetic complication. The acute diabetic complication, one of the very common one is the low blood sugar. We all know, I think we all know. So diabetic patient, because the body cannot produce insulin, and therefore you need inject insulin to actually to convert your food into that, and then therefore you sometimes you need to control your food intake of sugar intake. But the problem is that if you don't have enough of blood sugar, right, you will also having a medical condition that is need medical attention. Now, what are the symptoms of low blood sugar? Right, very typically is that you will have trembling shaking itself. This is the most common first symptom itself. Sweating, followed by sweating and fast heartbeat. These are the body telling you that I need sugar, I need energy input, right? So anxiety or nervousness, hunger, these are also a frequent symptom, right? Then, therefore, in here, these are the early symptoms of the condition whereby that you should know that, okay, if I'm having this, better go and check my blood sugar, or basically I should be ready to take in some sugar or carbo and see whether that this condition subside or not. Now, it's very important that if this symptom doesn't subside and then actually you go into a severe symptom of confusion, you lost your coordinations, and then you have a seizure, then the patient must rush and will require medical attention immediately. So it's very important to recognize the symptoms of low blood sugar, because these are the risks associated with people for late-stage diabetic patient. Okay. Now, one thing to prevent suffering from the hypoglycemia is look at what are the common triggers. The common triggers in hypoglycemia here are one, medication over short of insulin dose. This one, that's why that insulin dose you have to be controlled, be very careful, right? Second is that the trigger are the actually excessive alcohol consumption. Now, alcohol interferes with the liver's ability to release glucose into the blood. Therefore, for diabetic patient, especially for late-stage diabetic patient, this is very important to avoid alcohol intake if you can, right? Then, never fast, and you should not fast. Diabetic patients should eat at the regular interval and should never go on fasting. Remember the previous session I discussed about the fasting is one of the what we call intermittent fasting is one of the effective modality for weight management, but it is contraindicated for people who are suffering from diabetic condition. Why? It is because that fasting will cause you to run a risk of having low blood sugar. All right. Well, very important also that the diabetic patient should refrain from intense physical activities itself. So the vigorous exercise will deplete the glucose level. Right. So it's very important. Right. If you want to exercise, you should eat some food first before you exercise. Okay. Now, who are at risk of having suffering from hypoglycemia or severe hypoglycemia? Actually, that's a very interesting finding that I want just for everybody's information itself. For diabetic patient, if you are not obese, in fact, you are underweight, then you run a higher risk of suffering from severe hypoglycemia compared with a person that is actually overweight, right? So if you look at this chart itself, right, the body mass index itself, right, this point is actually what we call the healthy point. This point is where we consider the healthy point crossover 25, 18 to 24 is between. Here, this is a healthy point itself. But you can see that if you are actually, your body mass index are lower than 22, that means that you are actually quite healthy in the normal weight. You probably are underweight, you are lower than 20. Then your risk of having suffering from hypoglycemia actually goes up very much rapidly. Whereas actually, if you are overweight, right, or even obese itself, actually your risk of hypoglycemia actually are lower. So for diabetic patient, overweight person are safer from the suffering of acute hypoglycemia compared with underweight person, right? That's the point. That's just a point, very important. So therefore, if you're underweight and you're suffering from diabetic condition, more so that you have to be very careful about your acute complication of severe hypoglycemia. This study actually is from Korea, so it basically represents the Asian profile, Asian profile itself. All right. So here you can see from here what are the strategies. First, I think we recommend always regular monitoring of blood glucose level, right? adjust the insulin or medication dosage based on blood glucose reading and plan your activities properly. Avoid the trigger we mentioned earlier, and eat balanced meal with regular snack if necessary. That means that you should not have fasting and you should not eat irregular meals. Okay, right. Another one actually is a very important one. These are actually the medical emergencies. Diabetic patient can suffer from diabetic ketoacidosis. This is actually a life-threatening condition where your body cannot produce enough insulin, and actually the body produce high level of blood acid in ketones in there, right? So what are the symptoms? Early symptoms of people suffering from these life-threatening conditions are actually excessive thirst, frequent urination. Yeah, very often it's like a common diabetic patient problem, but one of the key indicators is the high blood sugar level. So this is the first very important primary indicator of suffering from this condition, right? Now, once this condition is not contained, right, then the condition will turn into more medical emergency, which actually very typically the symptoms are having fruity scent breath. This is very distinctive of ketones in there. So in there, if you have this indication, means that you're suffering from DKA, and this is actually a medical emergency. And if you are suffering from deep rapid breathing itself, these are a very common emergency symptom for patient. So for diabetic patient, if you are having a fruity sense breath, right, and you're suffering from deep rapid breathing, please call 911. Send the patient is a medical emergency, you need treatment itself. What are the common trigger for this condition? First, you miss the insulin injection, right? Another common trigger are actually people suffering from infection. When you're sick, it's very important, especially for diabetic patients. If they are sick, infection, very important to monitor, prevent them suffering from this complication itself, right? And diabetic patients should not be stressed. When you're stressed, you also can lead to DKA itself. So therefore, it's important to watch out. First of all, especially for diabetic patient, when you're sick, the caregiver must be very careful, and actually, because it can trigger a medical emergency of a DKA itself. Okay, now, in the TCM context for diabetic patient, right? So if you are taking medication, for instance, you're taking metformin, and sometimes the metformin still doesn't work well, right? So actually, in TCM, there's also what we call therapeutic for people who suffer from diabetic patient. Although diabetic is not a medical condition actually defined in the formal TCM context. TCM physician doesn't look at diabetic as the Western way of looking at the blood sugar level. They look at it from a different perspective itself. So, but having said that, all right, this medication formulation, right, we call Liu Wei Di Huang Wan, is actually a very famous TCM medication for diabetic patient, right, for diabetic management. In fact, it's very often used in combination with metformin to potentiate the metformin's effects on diabetic management itself. These are the two very authoritative study of actually Liu Wei Di Huang Wan combined with metformin on the clinical results of clinical efficacy, right? So basically, the combinations are proven in use, and they are effective, and actually they have high safety itself, right? Okay, now this is the final one, and it's probably the most important part of the whole session. If you look at it itself, it takes me about 2 weeks of deep research to quantify and qualify the most efficient, effective nutraceutical supplement for diabetic management, right? In here, I list them, I list the 5 of them, right? And you can see from here, the top in the range of efficacy are the berberine. It's a TCM compound, right? Okay, and you have very effective efficacy in fasting glucose control and HbA1c itself, right? Followed by bitter melon, which I think that Tommy have a product actually, which is a bitter melon extract. We will discuss shortly, right? And then followed by Graminia sylvester. This is actually Ayurvedic herbs from India, very popular one. Both are actually effective for diabetic management. Then followed by alpha lipoic acid, all right, which is commonly found in a lot of greens and vegetables, as well as actually in organs of the meat itself, right? Then followed by ginseng. Ginseng are the least lowest effectiveness among the range here, but I put it in is because penta ginseng have a lot of multiple target, which I mentioned earlier. You can see that ginseng is very suitable for diabetic patients because it works on multiple target and prevent multiple musculovascular complication itself. So therefore, ginseng is actually a very good multitasking supplement for a diabetic patient. It also helps to actually reduce blood glucose, although it's not as potent as berberine or bitter melon in comparison by itself. All right. So it's important. These are the validated compounds that have proven in use for as a supplement for helping to reduce diabetic glucose level. Okay, let's talk about the first product we're going to talk about tonight on Atomy, which is actually the Atomy bitter melon extract compound. Key feature is that it is a very high concentration standardized extract. Now, this is very different from a lot of bitter melon extract. I want to put it that and highlight to you is because that for Atomy members, you have to be very careful about that because this compound, right, this product have high extraction ratio, 1 to 320 extraction ratio, which means that it takes 320 kg of the natural bitter melon to extract out to derive and come out with 1 kg of the peptide extract itself. So that means this is a high concentrated extract itself, which means it have high potency. So high potency comes with high side effect if you overdose. Remember that, all right? So therefore, this is a compound that also have been verified. There are clinical papers that based on this compound, take what is the effective dosage. So basically, the effective dosage that is used clinically in this study is 600 milligram of the bitter melon peptide daily, right? 600 milligram bitter melon peptide is equal to how many tablets? You see that each tablet is 150 milligram. So this is equal to 4 tablets of bitter melon tablet daily. So this clinical study is based on 4 tablets daily to get the result itself. So this is the level whereby it's been used in clinical context. Okay, now, so what are the applications of Atomy bitter melon extract, right? So as we say, it's for diabetic patients. So obviously, it works for people who are pre-diabetic itself. So for pre-diabetic, you can take 1 cap once or twice per day. But for diabetic type 2, you can take 1 cap twice per day according to the instruction. Currently, it's a normal one. And metabolic syndrome is basically diabetic plus hypertension, or you have other conditions itself, right? You also can take the same 1 capsule twice per day. Now, you can take up to 4 capsules per day if you look at based on the clinical study itself. So this is still a safe limit for you to take itself. Now, remember, because bitter melon, this bitter melon product extract does actually able to reduce your blood glucose level, which is very important for diabetic patients to know that when you are taking diabetic medication, right, you should not overdose on this one as a supplement. In fact, if your diabetic medication is already working and diabetic condition is under control, there's no need for you to take this as a supplement. Remember, it's only that where you do not take any medication and you think that you need to control a diabetic condition, then you can take this supplement as a substitution for any medication in controlling the diabetic. But if you are combining it with a diabetic medication, you should monitor your blood sugar level, glucose level very carefully and do not overdose. This is a very important thing because if you overdose on it, you're going to suffer from the acute complication of hypoglycemia, low blood sugar. So remember. Okay, now what are the contraindications for bitter melon? I think this quite sort of simple. Most of us will probably be aware, but I want to just go through it. So people who are pregnancy, women are pregnancy and breastfeeding should not take. Children under the age of 12 should not take. People who suffer from G6PD deficiency. This is a deficiency of genetic deficiency which cause your blood to actually break down earlier. So this is very common, not very common, about 1 to 2% in the Chinese population in Asia so far, I think, on that itself. So people who are suffering from G6PD deficiency should not take bitter melon, right? Of course, if you are suffering from low blood sugar, you should not take bitter melon. There's no reason to take it. You're going to get it worse, right? If you suffer from low blood pressure, again, you should not take bitter melon because bitter melon can lower your blood pressure further, make it worse itself, right? People with digestive problem, bitter melon can cause GI effects such as abdominal pain, diarrhea, and upset stomach, right? People with liver and kidney diseases, because of liver and kidney function is low, so you should not take bitter melon unless necessary itself. And surgery, right? For surgery, bitter melon affects your blood sugar level, right? Very important, it affects the blood sugar level. So therefore, the bitter melon extract should be discontinued at least 2 weeks prior to any scheduled surgery to avoid complication with blood sugar control during and after the surgical procedure. Okay, now another product which is the banded ginseng that we commonly say. Ginseng, what are the ginseng's actually pharmacological function property? So you can see from here, I summarize it. Based on a systematic review and meta-analysis itself, we concluded that ginseng have all these functions. One is that it actually is beneficial for people who suffer from diabetic patient because it can reduce your glucose level, right? It also beneficial for people who are overweight, obesity, right? It can actually help to reduce your blood pressure, right? And it also can help to reduce your triglyceride and bad cholesterol, sorry, right? So basically, it covers the full spectrum of the metabolic syndrome. So ginseng is a very effective, very useful herb because it covers a full spectrum of the metabolic syndrome, which include diabetic condition itself. Right. So the Atomy Homsandan basically is actually a Korean ginseng. You can see from here that I just actually make a simplified table. Now, very commonly in the market, we find there's 3 types of ginseng. The Asian white ginseng, which is called Chinese ginseng. Asian red ginseng, which is actually a Korean ginseng itself. These two are actually belong to the same species of ginseng, called pentec ginseng. So they are same. Pharmacologically, they are same, except the process of red ginseng is different from the white ginseng, that's all. The process are slightly different itself. Right. But the Western ginseng, which is the American ginseng, are of a different species. So they have different pharmacological function. So do not what do you call, compare them with the Chinese ginseng or the Korean ginseng, because they are different species altogether. So we should not be confused. The Korean and Chinese ginseng with American ginseng. They are different. Okay. So in Atomy Home Sandan itself, again, Atomy product, one of the is the Home Sandan is actually a medicinal product in Singapore, HSA registration as a CPM product, right? It is a standardized red ginseng extract. Right? Again, it is a standardized extract that have high concentration. One stick is equal to 1 gram of red ginseng concentrate, which contain 20 milligram of ginseng oxide itself, right? So that means that one stick you will have 20 milligram of ginseng oxide, which is the key pharmaceutical ingredient of active ingredient of ginseng itself. Now, what are the applications for Home Sandan itself or the ginseng itself? We know ginseng help to improve mental and physical performance, anti-fatigue, especially good for chronic fatigue syndrome, right? Ginseng also good for people who suffer from cerebral insufficiency, impaired memory, dementia, or Alzheimer's disease, basically diseases of central nervous system. So, ginseng also is beneficial for people who suffer from metabolic disorder, which include type 2 diabetic, because it helps to lower your blood sugar. You also help to lower your bad cholesterol and total cholesterol and improve your good cholesterol itself, right? Of course, we know that ginseng also beneficial for cardiovascular disease patient, especially its protective effect on coronary artery diseases, right? Heart failure, hypertension, and arrhythmia, all right? And ginseng also actually have shown benefit in respiratory tract infection. So if you are having respiratory tract infection, you can also take ginseng to protect yourself, right? And of course, ginseng also commonly used to actually drive up the sex drive, which is to improve the libido of male sex drive. Okay, for ginseng itself, since it's actually a medicine and it has high potency, there's also contraindication and precaution should be observed, right? Again, the precaution for people not suitable for pregnant ladies, for breastfeeding, right? For children under 6 years, right? Breastfeeding, I want to put it with some caution. Breastfeeding, not so much of a concern in terms of that, but you need to be careful about pregnancy itself, more important on that. Severe kidney diseases, people who suffer especially on dialysis or end-stage renal diseases itself, people who suffer from severe liver diseases like cirrhosis, and also people who are suffering from bleeding risk, especially from aneurysm itself, right? So do not take ginseng without talking to your doctors if you are taking any of the following medication, especially anticoagulants, aspirin, right? The painkiller, non-steroid anti-inflammatory drugs, right? Corticosteroids itself, estrogen replacement therapy, right? And depression drugs and drugs that actually decrease blood sugar. So therefore, if you are on medication, be careful about that. Ginseng actually can interact with all this medication, and therefore, for your safety, basically you should space at least an hour before any of the medication intake with ginseng. Okay, this is the end of my talk for tonight. I'll pass